Chapter 6, Anatomy and Physiology. We're going to be talking about locating body organs and structures and the body systems. Locating body structures and organs is about visualizing and so let's talk about some body systems. Musculoskeletal system. Really, it has three main functions. So it gives the body shape, it protects vital internal organs, and it allows for body movement. Consists of the skeleton, which is the skull, the spine, ribs, sternum, shoulders, upper extremities, pelvis, and the lower extremities. The skull is a bony structure of the head, and its function is to enclose and protect the brain. The cranium is the top, back, and sides, and the face is the front of the skull. Skull connects to facial bones, so we've got the mandible, the maxillae, the nasal bones, the orbits, and the zygomatic arches. Here's the bones of the skull in full. It's not important that you memorize these, but you should have a pretty good idea of the facial bones and some of the areas of the skull, but you don't have to necessarily memorize the temporal bone and the occipital bone and things like that. But you do need to know the moving bone of the jaw is the mandible, the orbits, the nasal bone. So the spinal column has 33 vertebrae, and it's essential for movement, sensation, and vital functions. The thorax is going to contain the heart, the lungs, and major blood vessels, and it protects the heart, lungs, and major blood vessels as well. Here's the spinal column. You've got C1 and C2, which are also known as the atlas and the axis. There's 7 cervical, 12 thoracic, and 5 lumbar. Then below that, you've got the sacrum and the coccyx. I always remember these bones by you get up to go to work at 7, you take lunch at noon, and you get off work at 5. The pelvis consists of the ilium, the ischium, the pubis, and the hip joint. And you've got the acetabulum, which is the ball at the proximal end of the femur. And if you remember proximal, that's the ball at the end of the femur that connects to the pelvis, closest to the body. Your lower extremities consist of the femur, the patella or the kneecap, the tibia, the fibula, and the ankle. And on the ankle, you've got the lateral malleolus and the medial malleolus. Remember that the medial one will be on the inside of the foot and the lateral one will be on the outside of the foot. As far as lower extremities go, you've also got the foot, which has metatarsals, the calcaneus or the heel, and phalanges, which are the toe bones. Your upper extremities include the clavicle, the scapula, the acromion process, the acromioclavicular joint, the humerus, the radius, and the ulna. Then you move on to the wrist, or carpals, and the hand, which is metacarpals, and phalanges are the finger bones. There's a diagram of the skeletal system. Joints are formed when bones connect to other bones. So there's a couple different types of joints. There's ball and socket joints and hinge joints. Different types of muscles include voluntary, or your skeletal muscles, your involuntary, or your smooth muscles, and your cardiac muscles, which have automaticity, which means that the heart is able to generate and conduct its own electrical pulses. Here's an example of where you'll find your skeletal muscle, your cardiac muscle, and your smooth muscle. Remember, your cardiac muscle is only going to be in the heart. Your smooth muscle are things like the lining of your stomach. And your skeletal muscle is going to be obviously outside on this above and over top of the skeleton. So the respiratory system brings oxygen in via inhalation, and it excretes carbon dioxide via exhalation. Air enters the body through the mouth and the nose, and it moves through the oropharynx and the nasopharynx. The pharynx also includes both areas. Air moves towards the lungs. Then you've got your epiglottis, which closes over the glottis. Your larynx, or your voice box, is what contains your vocal cords. And your cricoid cartilage forms the lower portion of the larynx. Then you've got your trachea, the lungs, which break down into bronchi and alveoli, and then your diaphragm. There's your respiratory system. Nasal cavity, the pharynx and the larynx on the left. Your trachea, as it goes down through the center and to the lungs. The bronchial tubes, and your lungs. So inhalation is an active process. The diaphragm and intercostal muscles contract, the diaphragm moves downward, and the ribs move upward and outward. Negative pressure pulls air into the lungs. For exhalation, this is a passive process. The diaphragm and intercostal muscles relax, and positive pressure pushes air out of the lungs. Ventilation is the movement of gases to and from the alveoli, and respiration is the exchange of gases between cells and the bloodstream. So oxygenated blood is carried from the lungs to the heart. After that, it's pumped to the rest of the body. At the cellular level, oxygen, or O2, is exchanged with cells for waste, such as carbon dioxide, which is CO2. So deoxygenated blood returns to the heart, then to the lungs to exchange waste, CO2, for O2. Let's talk about some respiratory physiology as it relates to children and adults. So children are going to have a smaller nose and a smaller mouth, and the tongue is going to take up more space proportionally in the airway. Also, you need to consider that the child's trachea is going to be more narrow, and the cricoid cartilage is less rigid and much less developed. So given all these circumstances, keep in mind that airway structures for kids are going to be much more easily obstructed than in adults. As far as the cardiovascular system goes, it's comprised of the heart, the blood, and the blood vessels. So think of your heart as the pump, the blood as the volume, and the blood vessels as the container. So the heart has 4 chambers. It has 2 atria, which are the upper areas or the top of the heart, and it has 2 ventricles, which is the lower areas or the bottom of the heart. So the pathway for blood to run through the heart is through the right atrium, the right ventricle, then the left atrium, then the left ventricle, and out into the body. Here's an example of blood flow of the heart. You can see here at the top of the diagram of the blue, it comes in from the body, comes into the right atrium, goes down into the right ventricle, then it goes up the left pulmonary artery to the lung, then it comes in from the lung via the left pulmonary vein, goes in the left atrium, then into the left ventricle, and then it goes out into the body. Here's a diagram of the heart. It's not necessarily important that you guys memorize and understand this, but this is the cardiac conduction system. If you move on to advanced things like that, then we do expect you to know, in paramedic school and things like that, we need you to know the electrical system of the heart. But to start off, the SA node, or the sinoatrial node, is the heart's primary pacemaker. Then as you scroll down, get to the atrioventricular node, or the AV node, it's the backup pacemaker. Then it goes down into the atrioventricular bundle, or the bundle of His, as we commonly call it, down into the bundle branches and the Purkinje fibers. So important arteries you're going to want to know. Your coronary arteries, the aorta, the pulmonary artery, the carotid artery, and the femoral artery. Of these, the carotid artery and the femoral artery are ones that you'll be able to feel pulses from. You'll also want to know the brachial artery, primary area that we check pulses on kids, the radial artery, which is the primary place that we check pulses on adults, and you've also got the posterior tibial artery and the dorsalis pedis artery, or also what we call the pedal pulse on the top of the foot. This talks about the circulation of blood. Arteries do not have valves, but veins do because they're carrying deoxygenated blood up back into the heart. So the valves allow the blood to pump up to the heart, but not fall back down so that the pressure is decreased in the body. As far as the composition of blood goes, you've got plasma, which is more than half the volume of the blood. You've got red blood cells, or RBCs, erythrocytes, and red corpuscles. The components of white blood cells include your white blood cells, your leukocytes, and your white corpuscles, and your platelets, which help with clotting. So let's talk about pulse. This is a pressure wave of blood flowing down an artery when the left ventricle contracts. Since we know the left ventricle is what pumps blood out into the body, this starts to make sense. This can be felt by compressing an artery over a bone, such as the pulse on your wrist, the radial artery. You feel that by pressing the artery over the bone. Peripheral pulses are on the outer parts of the body, such as the radial, the brachial, the posterior tibial, and the dorsalis pedis. And your central are going to be the core of the body, such as your femoral artery and the carotid artery. Your central pulse are going to be pulses near the center of the body. Carotid and femoral pulses are felt even when the peripheral pulses are too weak to be felt. So your peripheral pulses are going to be the first pulse to leave. So if you can't feel a radial pulse, it doesn't mean they don't have a pulse. You'll just want to go to a central area and check the pulse, such as the femoral or the carotid. Blood pressure. Forced blood exerts against the walls of the blood vessels. So when you get a blood pressure, you've got an upper number and a lower number. Your systolic is going to be the upper number. This is your arterial pressure when the left ventricle contracts. And your diastolic, or your lower number, is going to be the pressure when the left ventricle refills. We refer to perfusion as adequate circulation of blood and exchange of oxygen and waste products. When you have a lack of perfusion, or hypoperfusion, thinking about putting the words together, hypo meaning low, so this is when blood flow becomes inadequate. So think about, how's the function of the respiratory system related to the function of the circulatory system? The respiratory system moves oxygen into the bloodstream through inhalation, and carbon dioxide is picked up by the blood and excreted through exhalation. The circulatory system is the heart, the blood, and the blood vessels. So the respiratory system needs the circulatory system in order to bring in oxygen and remove carbon dioxide from the body. So the respiratory system and circulatory system together make up the cardiopulmonary system. The interaction of these two systems is essential to be able to continue living. So let's talk about the life support chain. Interaction of respiratory systems and cardiopulmonary systems, or perfusion, where cells get oxygenated and carbon dioxide gets removed. Your lymphatic system, its function is to capture fluid and maintain that balance of fluid. The lymphatic system is comprised of the lymphoid organs, such as your adenoids, the tonsils, the spleen, the thymus, and the nodes. As a note, remember to avoid taking blood pressures on the side of a woman's body where she had a mastectomy performed. Here's the nervous system, which is comprised of the brain, the spinal cord, and the nerves. The nervous system, like we talked about, you've got the central nervous system, which is the brain and the spinal cord. You've got the peripheral nervous system, which consists of the sensory nerves and the motor nerves, and the autonomic nervous system, which is the involuntary motor functions. So remember, the nervous system consists of the brain, the spinal cord, and the nerve tissue. It's going to transmit impulses that govern sensation, movement, and thought. It also controls the body's voluntary and involuntary activity. So the central nervous system is composed of the brain and the spinal cord. The digestive system provides the mechanisms by which food travels through the body and is digested. So this is going to consist of the stomach, the small intestine, and the large intestine. Your accessory organs are going to include the liver, the gallbladder, the pancreas, and the spleen, along with the appendix. As far as the integumentary system, we're talking about the skin. Its functions are for protection, water balance, temperature regulation, excretion, and to absorb shock. Your layers are going to consist of the epidermis, the dermis, and the subcutaneous layer, as it relates from the most outer layer to the most inner layer. Diagram of the skin, showing the epidermis as the outer layer with the hair follicles, your dermis, which is going to have the sebaceous gland, arrector pill muscle, and the hair root, and then you're going to see in the subcutaneous layer looking at the sweat glands, nerve, veins, and arteries, and the fatty tissue. The endocrine system is what produces hormones that regulate many of the body activities and functions. It consists of the pancreas along with the adrenal glands, which secrete epinephrine. Here's a diagram of the endocrine system that shows all the other glands. You've got the ovaries in females, testes in males, the pancreas, the adrenal glands, your thyroid gland, the pineal gland, pituitary gland, and the thymus gland. The renal system is going to be your urinary system, helps the body regulate fluid levels, filters out chemicals, and it adjusts the body's pH levels. Consists of the kidney, which is the principal organ of the renal system, and the bladder, which is a fluid reservoir for urine. There's the components of the renal system. The kidney, you've got the urinary bladder, the ureters, the female urethra, and the male urethra. The ureters transport urine to the bladder from the kidneys, so there's two ureters, and the urethra excretes urine from the bladder to the external environment, so there's only one. As far as the reproductive system goes, you've got the female reproductive system, which consists of the ovaries, the uterus, and the vagina. There's a diagram of the female reproductive system. In men, you've got the testes and the penis. And there's the male reproductive system. So remember that as an EMT, your knowledge of anatomy or structure and functions or physiology of the body will be important in allowing you to assess your patient and communicate your findings with other EMS personnel and hospital staff accurately and efficiently. Remember the major body systems that we talked about today, in which you should start becoming familiar with: the musculoskeletal system, the respiratory system, the cardiovascular system, the nervous system, and the digestive system. We also want to know and be familiar with the integumentary system, the endocrine system, the renal system, and the reproductive system. Remember that cellular metabolism requires a constant supply of oxygen and glucose. Absence of either of these components disrupts normal metabolism. The cardiopulmonary system combines the functions of respiratory and cardiovascular systems to provide oxygen at the cellular level. Remember that shock occurs when the cardiopulmonary system fails and cells become hypoperfused, or have low perfusion. The body is composed primarily of water, and this fluid is distributed throughout the body systems. Questions to consider. When evaluating a patient with a cardiac problem, consider the impact on the respiratory system. When evaluating a patient with a respiratory problem, also consider the impact on the cardiovascular system. What impacts do the problems in these systems have on each other? Remember that the lungs, or the pulmonary system, Heart, blood vessels, and the blood itself, or the cardiovascular system, work in concert to perform pulmonary functions. The primary function of the cardiopulmonary system is to deliver the oxygen and the nutrients to the cell and to remove waste product from the cells. These basic operations rely on the coordinated movements of blood and air. Interruption of any part of this balance results in a compromise, or even a failure of the entire system. Shock must be recognized immediately. But what is the pathophysiology of shock? Remember that shock occurs when the regular delivery of oxygen and nutrients to cells and the removal of their waste products is interrupted. So without a regular supply of oxygen, cells become hypoxic and they must rely on anaerobic metabolism. Lactic acid and other waste products accumulate and they start harming the cell. So without the removal of carbon dioxide, the buildup of harmful waste products is also accelerated. Unless it's reversed, shock will kill the cells, the organs, and eventually the patient. So let's think critically here for a minute. You're treating a patient who is recently released from the intensive care unit with a massive infection, also known as sepsis. This has impaired the patient's ability to regulate the size of the blood vessels. How might this affect the patient's ability to compensate for any additional illnesses? What steps should you take to help the patient compensate? The patient's sepsis is going to affect the body's ability to dilate and constrict blood vessels. Thereby, it's going to decrease its ability to regulate blood pressure in any response to any additional illnesses or injuries. The BLS care for shock should initiate oxygen, warmth, and a position for comfort. This concludes the chapter.